My dear friends, these are extraordinary times when countries across the globe are fighting a pandemic called COVID-19. The World Health Organization has declared the novel coronavirus disease outbreak as a pandemic and called out to countries to take immediate actions and scale up response to detect, treat and reduce transmission to save people's lives. It indeed is a crisis of unparalleled magnitude for the whole world, and the need of the hour is to stand united and fight this crisis using all our resources. Since 8th January, our government has left no stone unturned in ensuring that we are successful in containing as well as mitigating this deadly virus. Our dear Prime Minister Shri Narendra Modi ji has been monitoring the COVID situation on a regular basis. He is a true hero who brings positivity to all of us in the deepest hour of concern. All arms of the government are in unison to meet the challenge arising out of this disease outbreak. All our overseas missions, our frontline health workers, our doctors, our paramedics, our airport screening staff, our security personnel, our armed forces, our airlines that flew our stranded citizens back to Indian soil, to say that it heartens me is a small word at this moment. They are fearlessly serving the nation. My gratitude also to all those unsung heroes whom I haven't given out a shout to, who are selflessly contributing to India's strategic interventions on COVID management. Government has taken all necessary steps to ensure hospital isolation of all confirmed as well as some suspect cases, contact tracing of all positive cases, community surveillance of all possible suspects, and quarantine of people at home as well as in quarantine centers. The Prime Minister's office, group of ministers, Ministry of Health and Family Welfare and Cabinet Secretariat are closely monitoring the situation. Having invoked powers under the Epidemic Diseases Act 1897 to enhance preparedness and containment of the virus, COVID-19 has been declared a notified disaster. State Disaster Response Fund as well as funds under National Health Mission have also been made available to states. Several measures have been taken by the central ministries along with states and UTs in terms of strengthened community surveillance, quarantine facilities, isolation wards, adequate personal protective equipments, trained manpower and rapid response teams for the management of COVID-19. The government is taking every possible measure to contain the spread of the disease. However, citizens have their role and responsibilities to discharge. The most important step to be taken right now for each and every person in the country as well as across the world is to follow the norm of social distancing. Social distancing is the simplest way for prevention of infection, to avoid contact between those who are infected with a disease causing pathogen and those who are not, so as to slow down the rate and extent of disease transmission. This eventually leads to decrease in spread, morbidity and mortality due to the disease. The Indian style Namaste is in vogue across the world today, because we don't need to shake hands or hug our friends to acknowledge their presence. Fold your hands with a nod of the head and say Namaste is the way to greet in COVID times. To ensure social distancing, we have already advised state governments for closure of all educational establishments, gyms, museums, cultural and social centers, swimming pools, and theatres. Students have been advised to stay at home. We are encouraging private sector organizations to allow employees to work from home wherever feasible. Meetings, as far as possible, should be done through video conferences. We should all minimize or reschedule our meetings involving a large number of people unless it is really necessary. Sports events are being postponed worldwide. Large gatherings are being discouraged. Similarly, marketplaces where people congregate are being regulated. We are also constantly requesting people to avoid non-essential travel. The big effort here is public outreach. We need to reach out to the masses on these precautions. We have to keep communities informed consistently and constantly. My Ministry of Health and Family Welfare has done a massive outreach in this regard and is making continuous efforts to increase its reach to the rural areas. I am worried about how some people are scared to hear the word quarantine and why there are so many misgivings about it. We all have to understand the meaning and significance of quarantining. When we detect a suspect case of novel coronavirus disease, we need to do a rapid isolation of such cases in designated health facilities and line listing of all contacts of such cases. On the other hand, home quarantine is applicable to all contacts of a suspect or a confirmed case of COVID-19. This intervention is a must and all guidelines on this must be followed. Why are we scared of home quarantine? The home quarantined person needs to stay at his own house in a well ventilated single room, preferably with an attached or separate toilet. We ask such persons to stay away from elderly people, pregnant women, children and persons with comorbidities within the household. Restrict their movement within the house and stop them from attending any gatherings. Many people have also been asking us about who should really wear a mask. You see, this disease is spread by an infected person coughing and the droplets from his cough infecting others in close vicinity of less than 1 meter. Any such new disease invariably related to cough leads to suggestions from various quarters, especially in social media, to encourage use of masks by the general public for prevention. First of all, I would like to clarify that persons having no symptoms are not required to use a mask. Mask is not required to be used by healthy persons who are not having any symptoms because it creates a false sense of security that can lead to neglecting other essential measures such as washing of hands. Further, there is scientific evidence to show that there is no health benefit of using masks for non-sick persons. On the contrary, erroneous use of masks or continuous use of disposable masks for longer than 6 hours or repeated use of the same mask may actually increase risk of getting an infection. It also incurs unnecessary cost. Instead, I recommend that you should wash hands frequently with soap and water thoroughly. Alternatively, an alcohol-based hand sanitizer may be used. If hands are dirty or soiled, do not use alcohol-based hand sanitizer. Instead, wash hands with soap and water. While coughing or sneezing, cover your nose and mouth with a handkerchief or a paper tissue. If handkerchief or tissue paper is not available, cuff into your flexed elbow. Dispose of the tissue immediately into a closed bin after use and wash hands thoroughly. Refrain from touching face, mouth, nose and eyes. Stay at least 1 meter away from those coughing or sneezing and monitor your body temperature. My mantra to you in these trying times would be take precautions and don't panic. If you take all precautions, mortality rate is very low, around 2%. Risk is higher in older people above the age of 60 years and in people with pre-existing health conditions. The lack of verified facts and floating rumors are to be blamed for this panic. The most important thing is when a virus is new, we really don't know how it may affect people. People ask me every day, will I die if I catch the disease? I tell them no. Most of the affected people have mild symptoms and recover from the disease in 2 weeks. Most of such cases can be treated with symptomatic management. There is also no evidence that eating meat or eggs causes COVID. The novel coronavirus is not known to spread directly through poultry products, but of course, experts say it can be a good option to have only properly cooked meat. People also write to us and ask why they can't undergo a test for COVID-19. Testing for coronavirus will only be done as recommended by the doctors and only if someone falls under the definition of a suspected case. This testing then can only be done through designated labs. You cannot get a home sample collection done for coronavirus testing because the virus is very highly contagious and can only be tested by special labs equipped to handle such contagious pathogens. People are recovering well enough from COVID. I suggest 3 actionable goals for all of you. Protect yourself, protect your loved ones, protect your community. If you feel unwell, seek immediate medical attention. If you have a fever, cough, or difficulty in breathing, stay indoors. Call healthcare professionals and follow their advice. Do not share just any forwarded message. Only share authentic information coming through medical experts. My friends, as I speak to you, all arms of the government are working overtime to protect you from this deadly disease. The slogan given to us by our revered leader, our Prime Minister Shri Narendra Modi ji is speed, scale, determination, decisiveness, sensitivity and solution. We are all working together under his able guidance and have made all possible strategic interventions to manage and defeat COVID. COVID will lose, India shall win. This is the spirit of New India. Together we will succeed in defeating COVID. Jai Hind.